Hello, my name is Allison Keene, and I'm one of the chairs of the NACNS Research EBP and Scholarship Committee with Sarah Knowles. Today, we're going to talk about abstract writing, where to begin, and how to succeed. We have a few learning objectives for today. We will identify the main components of an abstract. We have an example abstract we will review, and then finally we will apply that learning to draft an abstract outline, and that's where you will get an opportunity to start working on your own abstract. So let's start first by talking about what is an abstract. So an abstract is a clear, concise summary. This is really an opportunity for you to tell your story. And remember, as you're telling that story, that you are the expert in this work. So pull in not only the evidence, but your personal experience, your current state, problems, and how you have experienced that problem. This should be a standalone paragraph, so it should read very clearly for both your reviewers as well as your audience and your participants at the conference that this is clear really on its own in a short summarized version. The abstract can be structured or unstructured. A structured abstract typically has different headers, such as background methods, etc., versus an unstructured, which is just going to be a single paragraph typically. And then the word count ranges. So you might see, depending on the conference, you can see a word count anywhere as low as 250 up to 800. I've seen some as high as 1,000, but typically that 250 to 800. So just keep in mind too, we talked about the standalone paragraph. This will be not only the reviewer and the audience's first exposure to your work, so it really needs to be very clear, simple, and to the point, using very consistent language throughout, trying to avoid acronyms as much as possible. So we'll talk a little bit about some of those tips and tricks as we kind of go along here. So as we think about abstract writing, there are several do's and don'ts as you get started. So we already talked about being clear and concise. We also want to make sure that we have a very logical connection between the purpose, your methods, and then your results or your findings of that particular abstract. So we'll talk about that as we kind of move forward. And we already talked about keeping it simple. We also want to provide rationale. Don't assume that your audience knows about your problem and the significance of it. We have to tell them. So make sure that it's very clear in your problem statement. What is it that you're trying to achieve? What's the broad problem? What's your specific problem? And what's the gap? Also keep your intended audience in mind. Your presentation and your abstract are going to look very different if you're presenting to a group of clinical nurses versus presentation to an audience of nurse leaders. You also want to make sure to highlight innovation. What's new or different from your typical or common approaches to whatever problem you're trying to solve. So make sure to highlight those unique aspects or how you did things a little bit differently. And then moving over into the right column with the things you want to avoid, your don'ts, avoid using jargon or acronyms. Unless this is the only time acronyms are okay is if it's a commonly known acronym to your particular audience, then that would be acceptable. Don't introduce new concepts towards the end of your abstract. So make sure that those concepts are very clear from the beginning, middle, and then the end as well. So try and avoid introducing anything new. Also keep your unnecessary words, descriptors to a minimum. Again, keep it simple. And we talked a little bit about, don't assume others know the importance. Again, we have to tell them. And keep your language pretty objective. So we want to really stick to the facts and really the evidence, either clinically or within the literature that's really supporting the statements that you're making. So really avoid that subjective or emotional language. And then also avoid identifying your organization in your submission. So you can use really general language like a community hospital, an academic health center. You can identify your state or region, but at least in the original abstract, you want to avoid those identifiers. And just remember too, your reviewer and sometimes your audience members too, like you are the expert on your topic, but they may not be. So that's why it's really important to, keep that language simple and really minimize the jargon and acronyms. Also pay attention to your grammar and spelling as you go through. That's also really important and can be very distracting to your reviewers. Now, how do we prioritize writing ideas? You might have a few different projects or ideas that you've thought about writing an abstract. So a lot of times when I meet with folks, we kind of talk through the topics that might be most appropriate or important that they need to present. You might consider submitting a few abstracts. So you might have a couple different ones that you want to send over for a conference, and that's perfectly fine as well. Sometimes conferences will have a limit on how many that you can submit. But if you have some great work that you want to share, nothing wrong with submitting more than one. So as far as prioritizing these ideas, I typically try and guide folks to, what they're most passionate about. So what work is it that they're really excited to share about? Because if you're excited about it, it's going to make for a more compelling presentation if you can really, demonstrate that excitement and enthusiasm about the work. Secondly, what does your target audience need to know about? So, what are some of the pressing topics? So, when you think about like a clinical nurse audience or a CNS audience, what are some of those pressing issues that we're trying to solve for? Are we trying to solve for like nurse well-being or workforce shortages, things like that? So, think about those priority topics. What work do you have that's farthest along? What work do we already have that has outcomes or will have outcomes at the time of the conference? There's some conferences that will accept pending outcomes, but others that really want to see those outcomes. So it's typically better to pick work that's a little bit more further along where you have demonstrated outcomes. And then that kind of ties into the next one. What work has or will have the strongest outcomes? So think about, and a lot of times it's nice to have both your process outcomes as well as your, patient or organization or nurse outcomes. And we can talk about that a little bit more as we get into the example abstracts. And then for the target conference that you're intending on submitting, what are some of the topics of interest? Typically in those author guidelines, they'll have some specific topics of interest or a theme that they will present, and then you can align whatever you're working on with that or help that narrow you down on what you intend to submit. So for today, you will have some time to start drafting bullets for your abstract. So pick one to focus on today and get out some scratch paper or a Word document. And towards the end of this presentation, you'll have some time to draft some bullets for that. So now let's talk about writing team. This is incredibly important as we think about writing contributions, who to include, how to really get that done efficiently. And writing overall is a team sport. It's better together, and when we can work together as a team, usually more efficient. We can get it done a little bit more quickly, different ideas, a diversity of ideas kind of coming to the table. So think about who to include based on what specific projects you want to write up for an abstract and who contributed to that work. Um, so when you think about your project team, you might think about, or your writing team rather, you might think about who was on the project team that implemented the work. Where did those original ideas come from? Who was maybe involved in some previous writing? Maybe you had a previous abstract or a previous manuscript. So who was involved in that? Keep in mind that some conferences do have a limit to the number of authors. So that's important to note. And then all authors must contribute to writing and review in some way. So make sure that all of your authors that you include had some type of contribution, not only to the writing, but everyone also has to review the abstract before it gets submitted. The author order is negotiated up front, and that is typically based on the writing team contribution as well as team discussion. So something to discuss and kind of get down on paper early. Make sure you take a record of the date and who was decided to be in, first author, second author, etc. Next, I wanted to touch on some different abstract types. This is not an all-inclusive list, but it kind of gives you an idea of some different approaches that you can take to abstract writing. So let's start with intervention. So that is the most common abstract type. That is going to include some type of change and evaluation outcomes that go along with that change, typically some type of pre-post evaluation. Moving on to program description, these may not have outcomes, but it's going to describe how a program, usually education, was developed. And like I said, it may have outcomes, but it may just be a standalone description. Moving on to a case study, that is going to focus on a disease process, treatment, and outcomes. It could be a single patient or a collection of patients in that case study. And then finally, how to. So this might be, different strategies to identify a specific issue. So for example, strategies to identify sepsis, how to make education content more interactive, engaging. So there's some kind of different examples of how you can do something from, treatment of a patient population, disease process, or how to develop education or teach others. So now we're going to shift over to focus on the NACNS abstract structure. This is in alignment with the 2026 guidelines for submission. Each year, those are sometimes slightly different. So again, it's important to kind of refer back to those author guidelines whenever you're preparing your work. But essentially for 2026, the structure includes the title, background and significance, purpose and or objectives, your method, process, or framework, results or outcomes, and then conclusions and implications for practice. One of the other requirements for the conference abstract guideline is to include learning objectives. So these learning objectives help the audience as well as the reviewers know what to expect as far as what you're going to be presenting. So this should be very much in alignment with how your abstract is laid out, and then it will also help you to organize your presentation if your abstract is accepted for presentation at the conference. So for NACNS, 3 learning objectives are required, and it's important that those objectives line up with your purpose and abstract text. And you'll want to make sure to use action verbs, such as some examples are apply, describe, explain, or analyze. So this is not an all-inclusive list, but just some examples. And then you can refer to Bloom's taxonomy for other action verbs for consideration. Now let's dive into the specific abstract components. So starting with the title, you can have up to 120 characters. And some kind of rules of thumb as you think about developing your title is you'll want to include abstract keywords. So don't make it a mystery what your presentation's about. A lot of times the conference participants are selecting what presentations they're going to attend based on the title. So it's very important. So keywords, you'll want to stay very clear and consistent, just like your abstract text. And then, keep it interesting and a little eye-catching. You want to really pull in, again, like the unique or value add in your presentation, but making sure also that it's very clear what it is that your presentation's about. So we'll look at an example title here in a bit. Moving over to background and significance, this is the why of the work, and you're going to have up to 100 words. And this is really your opportunity to answer some of the below questions. So why do we care about the problem? This could be your incidence, prevalence, maybe some negative consequences of the problem that you've identified. what is known about the problem? So how have others tried to perhaps solve this issue? So what is in the literature? What are some current state maybe solutions in your environment? And then finally, what is the gap? So based on your problem and what is known, what's the specific gap that you are going to solve that you're going to talk about in your abstract? And this is usually where you'll pull in your references. So for the 2026 guidelines, you're required to include 2 to 3 current references in APA 7th edition. So the background and significance section is typically where you're going to include those references. So just keep that in mind. For your purpose and objectives, this is your what. This is how you're solving for that specific gap that you identified in your background and significance section. You have up to 50 words for this section. And so for here, you want to think about how are you going to fill the gap that you identified? What is it that you want to achieve through this project, abstract, etc.? There's different ways you can kind of write that. So we will look at an example of that here in a bit. Moving on to the method process framework, you can, select one of those headers or have maybe more than one. Maybe it's method and framework, whatever suits your abstract best. But this is really the how. What were the steps that you took to achieve your outcome? So you have up to 200 words here. So here you want to focus on, what is your specific project or study type? So is it quality improvement? Is it evidence-based practice? Did you do a pre-post evaluation? Was this a qualitative study? So really identify what that specific method was that you used. Moving down to your population and setting, you'll really want to specify, again, generally what your setting was that you did the work, and then what your population of focus was. Was it nurses? Was it patients? So be really clear about who it was that you engaged in your work. And then what did you do to get your results? So what was the intervention of focus here? Moving down to data collection, what was the specific data that you collected? Did you create your own surveys? Did you use established instruments that have reliability and validity? Did you do interviews? What did that interview guide look like? So be very clear on how you collected your data, and very important that you that you describe collection, if applicable, both your process and your outcome measures. And then how did you analyze your data? So did you do some descriptive statistics? Did you do a qualitative analysis where you were doing coding? Did you look at a pre-post evaluation and look at the difference of mean scores on a survey instrument? So be very clear on how that data was analyzed. Moving over to results and outcomes, this is what you achieve based on what you implemented. So this you get up to, for this section, up to 100 words. And for this section, you want to think about who responded to your evaluation, how many. So this would include potentially your demographics if you did research. If it was not a human subjects research study, you might think about, how many audits were completed, how many nurses responded to your survey. So depending on if it's more like quality improvement, EBP, or research, you might go less or more in depth on your population of interest. And then what happened to your process and outcome measures? How did they change? And make sure also to clarify your baseline, your intervention, and your post-intervention timeframe, so it's very clear for your reviewers as well as your audience when you go to present this information. And your results should really match the outcomes that you described in your method section. And then finally, your conclusion and implications. This is where you're going to wrap everything up. You get up to 150 words here. So here you want to really describe what you achieved through this work. What was a summary? Typically, the section starts with a broad summary of your findings. What does your project uniquely add? So what is unique about what it adds to either your practice setting and or the literature? You might also think about what you'll do next based on what you found. What are some next steps that your team has planned based on the progress you were able to make? And then finally, what should others do based on what you found? So when you think about these others, they might be clinicians, they might be researchers, policymakers. So who is the target audience that you expect to do something based on the work that you did? So now we're going to look at an intervention abstract example. This is an abstract that was presented at the 2025 conference, and we slightly adjusted it because the guidelines were a little bit different this past year. So we adjusted the abstract slightly to really mimic the 2026 guidelines really closely. So let's dive in here. The title of this abstract is From Research to Practice, Advancing Nursing Competency and Implementation Science. So you'll see as we kind of go through the example how we pulled in keywords. We tried to keep it, kind of brief, but also very consistent with the topic that we're focused on here. And as far as learning objectives, you'll see some of those verbs that we talked about using Bloom's taxonomy here. So the first one we have describe, and then we have analyze and apply. So again, make sure as you're working on your learning objectives that you're referring back to the Bloom's taxonomy. I always just Google that really quickly and kind of have it up on another screen as I'm working through my learning objectives. So our first objective is really to describe the initiative that we implemented to enhance knowledge of implementation science and adoption of practice change. The second objective is analyzing the implementation project progress and our participants' confidence and ability to implement EBP. And then the final one is to apply those program learnings to the CNS role and practice. So looking at the background section that really teed up this abstract, the problem is highlighted in yellow. So really the problem that we were trying to solve for is the research, translation, and practice. It takes about 15 to 17 years. That's what the evidence is telling us. So that was really the problem that we were trying to solve for. When we thought about what is known about this problem, that's where you have the blue highlight here. We know that implementation science can help accelerate evidence-based practice adoption. So this is something that we can use to make this problem better. And then when we thought about our specific gap for this, you can see that in purple on the slide, but nurses need this advanced knowledge so that we can better integrate evidence more quickly into practice. So how are we using some of these principles to really advance implementation of EBP? Moving on to the purpose. Again, this should talk about how we're filling the gap. So you can see we have highlighted in green here, we did an implementation science education program. And what is it that we wanted to achieve specifically? We wanted to improve nurse confidence, ability to implement EBP. And then we also looked at their project progress. So you can see that they're highlighted in yellow. So those were really our outcomes of focus. So moving on to the methods, the project type, we did a program evaluation. So we had an education program. You see that highlighted in blue there. And then looking at our participants in purple, we had 21 nurses and nurse leaders across a large Midwest healthcare system. So again, we kept the setting very general and then also described our population of interest. And then looking at the intervention, you can see that there in green, but we had 8 asynchronous modules from a recognized university. And then we also had a community of practice that we integrated in with those asynchronous modules as folks worked on their projects. Moving on to data collection, you can see, and again, if you think about what we just talked about from the purpose, the outcomes down here are highlighted in yellow. So we looked at excuse me, confidence and ability to implement EBP, as well as project progress. And then our data analysis, pieces are highlighted in blue. We used a paired samples t-test as well as descriptive statistics to analyze our data. All right, so moving on to results, you can see that we had in purple, we had 9 participants that were involved in the evaluation portion. And then all of our outcomes are highlighted in green. So we did have a statistically significant improvement in participants' confidence using implementation strategies. Although the ability to implement EBP was high at baseline, there was a non-significant improvement that was observed with our participants, as well as there was some demonstrated advancement in the individual projects that were part of this program. And then finally, for the conclusions, implications section, you can see that we did have one, as I mentioned in the previous slides, one summary statement that kind of teed this piece off. So really our summary highlighted that our program can enhance implementation science capabilities. So that's in yellow there. And then the blue part is really what was our unique ad. So really we felt like we had a flexible, scalable approach. Our team at the time were not experts in implementation science, so we really were able to use existing content that was developed by experts and then kind of pull in that community of practice to enhance that experience for our participants. And then finally, what can others do? That's where you can see in purple, if we had broader application of this model, more uptake from other institutions that might be able to accelerate EBP integration and really improve outcomes across our healthcare organizations. So wrapping it all up, putting everything together, really important. We've talked about the consistency. We really want to see that from start to finish. So reflecting on the abstract that we just looked at, when we think about our problem and purpose, you can see that, we talk about EBP, EBP translation, needing the knowledge and advanced skills to implement and sustain EBP. And then we start pulling in implementation science as the solution. Moving on to the method, our education program is focused on implementation science, and then our outcomes are really closely tied to EBP, again, looking at confidence and ability to implement EBP. And then moving over to results, our results are very much aligned with the methods section where we're looking at confidence using implementation strategies, ability to implement EBP, and what those outcomes were for those specific outcomes. So you can see how those concepts stayed very consistent and again were threaded all the way through those sections of the abstract. So now it's your turn to start your outline. And in this section, what I would suggest is as you have your, pen and paper or your Word document that you're ready to get started on, you can pause on each one of these slides, just hit a pause on the recording and start working on your bullets. And then when you're ready to go to the next section, you can just kind of move on and continue to make progress with your abstract. So starting with the background and significance, we're just going to kind of answer these questions. So again, use these as prompts to start your bullets. Don't worry about perfection at this point. This is really about just making progress, building momentum, get some words down on paper. That's all you're really focusing on here. And don't worry about your references. You can get those at a later point. So what is the problem that your project addressed? What was the problem you were trying to solve? What is known about that problem? Incidence, prevalence, negative consequences. What do we know about the problem? What's going on in your environment? Not only the literature, but what's also going on in your local environment. And then what is the specific gap that your team solved for or is going to solve for? So pause on the slide and get your bullets down for each of those questions. Now for your purpose and objectives, what was done to fill the identified gap? What was the specific action that was done? And then what did you want to achieve? So here you're typically going to have your intervention described as well as your key outcome or outcomes that you are evaluating. So again, you can pause here, write down your couple of bullets, and then we can move on. For your method process framework section, what was your specific project type? Make sure to clarify, was it quality improvement, program evaluation? What was your population and setting? Again, in this stage, you're going to keep your setting very general and not specific. What was your intervention? What was the change that you implemented? And then what were your outcomes? What were the specific outcomes that you measured? How did you measure them? And on what timeline? So again, you can pause here and capture all of that information. Results and outcomes. Again, we're just going to answer these question prompts. Who responded to the evaluation? How many people? If you did a research study, make sure to include your specific demographics. What happened to your outcome measure, or what did you discover? And we keep talking about this, but just make sure those results, it should be the same as what you described that you were going to measure in your methods. Keep that stuff very, very tight, very consistent. And again, make sure we're clarifying our baseline intervention, post-intervention timeframes as we're making these comparisons so our audience can follow along. So pause here and work on these bullets, and then we'll move on. All right, and finally, for your conclusions and implications section, what did you achieve as a result of your project? Again, this is going to be your overarching summary statement of what your team achieved. What does your project uniquely add to your practice setting or to the literature? So what was the innovation? What was different, unique? How did you approach things in a new or different way? Make sure to highlight that. What will you do next based on what you found? So if it's relevant, what are kind of some of your next steps based on the progress that you've made so far? And then finally, what should clinicians, researchers, and or policymakers do based on your findings? That's the whole reason for disseminating our work, is so that we are motivating others to do something. So what is that something, and what is the audience that you're trying to motivate to action? So again, drop these bullets down. All right, so now that you have drafted your abstract, your next steps are to think about how we can revise, finalize, and then submit. So identify, based on your background and significance section, identify some supporting references that support your statements within the last 5 years. Again, you need 2 to 3 in APA that will support those statements. Next, I would recommend finding 1 to 2 peer reviewers to look at your abstract. So as you get it into a final draft, find some peers, experts, non-experts in your topic that can provide you some feedback before submitting. And then make sure you're following the NACNS presentation abstract guidelines so that you're staying really close to what the reviewers are going to expect as they start reviewing these abstracts, and submit through proposal space. You can find all of this information if you go to the website. So if you're on the website, go to news and events, and then the annual conference, and that's where you can find all of this information. Really, that's where it is every year, where you can find the presentation abstract guidelines and where to submit. So thank you all so much for joining today, and wish you the best of luck in your abstract submission and writing. Thank you.